Excellent. Good afternoon, everyone. My name is Irvin Bishop, Federal Advocacy Manager with Share Our Strength. We're so delighted to have you join us for a congressional briefing surrounding child food insecurity in rural America. Before we get started, I have a few housekeeping items to mention. First, this webinar is being recorded. Your lines and video will be muted throughout. And finally, we'll have a Q&A segment with our moderator and panelists at the very end of the briefing. Should you have any questions throughout the briefing, please add them using the Q&A button located at the very bottom of your screen. I'd like to introduce my colleague, Monica Gonzalez, Director of Federal Government Relations, who will assist us in fielding questions during the Q&A segment. I now have the privilege of introducing my colleague, Derek Lamberg. Derek leads the development of the No Kid Hungry campaign's Rural Child Hunger portfolio and provides oversight for No Kid Hungry's Summer Meals portfolio. Thanks so much for joining us, Derek. I'll turn it over to you.
Hello, everyone, and thank you for joining today's congressional briefing on child food insecurity in rural America. As Irvin mentioned, I'm Derek Lambert with our No Kid Hungry campaign, Share Our Strength, and I'm fortunate to be joined by Irvin and Monica, as well as some fantastic panelists I'll introduce shortly. I also want to recognize the colleagues whose hard work behind the scenes have made today's event possible, including Chelsea McCormick, Latoya Austin, and Carolyn Vega. So a little bit about No Kid Hungry. We are a campaign of the Share Our Strength organization. And through our No Kid Hungry campaign, we are committed to ending childhood hunger in the United States by helping launch and improve programs that give kids the food they need to thrive. And while food insecurity is a reality that touches rural communities across the United States, it's a problem for which solutions do exist. Effective federal food assistance programs are out there that help close the gap for children and families for whom food access is a challenge. Too often, however, these programs aren't reaching the kids and families that need them. Our No Kid Hungry strategy focuses on problem solving, working with local partners to identify and eliminate barriers for kids. And we've awarded more than $57 million in grants over the past 12 months. Our grants fund a wide variety of projects and innovations that are driven and implemented by trusted local leaders and tailored to community needs. More than half of our grants this period have gone to organizations serving communities of color, and more than a third of grant dollars have gone to support work in rural areas. We provide families and caregivers information about nearby food assistance as well through our No Kid Hungry Free Meals Finder service, which includes a texting component, food or comida, texted to 877-877 for results in English and Spanish. And the hotline has provided information on local food assistance resources to more than 1 million users since it launched in 2013. No Kid Hungry also provides regular training webinars and toolkits highlighting best practices for program providers. We convene key stakeholders at virtual and in-person events, such as our third annual Rural Child Hunger Summit, which took place online back in March. We conduct advocacy on Capitol Hill and with USDA on congressional legislation, COVID-19 waivers, and other regulatory guidance. And even as vaccinations advance and restrictions ease in many parts of the country, the economic impact of the pandemic is likely to endure for years, creating additional challenges for families and putting even more kids at risk of hunger. Poverty rates are higher in rural areas compared to urban or suburban areas, placing families at greater risk of hunger and food insecurity. And rates of persistent poverty, or poverty rates of 20% or higher over a period of 30 years, occur disproportionately in rural areas. The pandemic has exacerbated rates of hunger and food insecurity in many rural communities, where census data indicates over 4.5 million children already qualified for free and reduced price school meals before the pandemic. The correlation between persistent poverty and food insecurity is striking, and it corresponds to several rural regions and populations that include Central Appalachia, the Southern Black Belt, the Colonias of the Rio Grande Valley, tribal lands, and migrant and seasonal farm worker communities such as those found in California's Central Valley. In most cases, persistent poverty is overlaid with legacies of historical trauma that include land dispossession, resource extraction, and systemic racism affecting marginalized communities, especially communities of color who represent more than 20% of the overall rural population in the United States. Chronic hunger has a well-documented effect on a child's well-being. It also has a profound effect on our education and our health systems, as well as our economy. And as a nation, we rightfully expend great time, effort, and resources caring for our children. And ensuring that a child has enough healthy food each day isn't just the right thing to do, it's the smart thing to do. And when we allow our nation's children to go hungry, we're robbing this nation of the brightest minds and best talent for our future. So today, we're going to dig into what's working well and what the challenges are to increase food access for children and families in rural communities during the summer months. As a reminder and level set, the United States Department of Agriculture funds free summer meals through the Summer Food Service Program and the National School Lunch Program's Seamless Summer Option. Through these programs, meals are served at thousands of sites like schools, parks, community centers. These meals are free to kids and teens 18 and under. No identification or registration required at these sites. Site eligibility is normally established at the community level based on school-free and reduced-priced enrollment or census tract data. The waivers for summer 2021 have expanded eligibility to all communities. Meals served follow USDA nutrition guidelines, and families don't need to apply to the program or show proof of income in order to participate. One key development over the past year is the degree to which United States Department of Agriculture COVID-19 waivers have helped overcome barriers to reaching children and families with food assistance programs, including summer meals during the ongoing health crisis. The pandemic afforded us an opportunity to road test different methods of feeding kids. Programs such as Pandemic EBT served as a lifeline for so many kids and families who couldn't access a meal site. And that's why it's imperative we make summer EBT permanent nationwide. No Kid Hungry recently conducted analysis to measure the impact of these waivers, and we found that there were 4 times as many meals served in rural communities due to waivers allowing innovative delivery models, such as home delivery and meal bundle distribution. Importantly, or interestingly as well, non-rural areas saw nearly as large an increase. And that demonstrates that the common access barriers, such as inconvenient meal service times or site locations, lack of transportation, or limited economies of scale, they're not unique to our rural communities. To successfully end summer hunger in rural communities and elsewhere, it's critical to make permanent these waiver flexibilities, allowing kids to receive multiple meals at one time for off-site consumption. To unpack this topic and to share their own experiences reaching rural communities with summer meals during the pandemic, and to help us think about the year ahead and lessons learned to inform child nutrition reauthorization, we are joined by 3 fantastic panelists that I'm excited to introduce now. Kathy Webb serves as the CEO of the Arkansas Hunger Relief Alliance after previously serving on their board of directors until 2012. Webb is also an elected member of the Little Rock City Board of Directors and formerly served in the Arkansas House of Representatives. The Alliance is the statewide anti-hunger umbrella for Arkansas. Welcome, Kathy. We're also thrilled to have Amanda Harvey, Nutrition Services Director with Fresno Unified Nutrition Services in California. Amanda is a graduate of the Fresno State Food and Nutritional Sciences Program and has worked with Fresno Unified Nutrition Services for the past 6 years and helped lead the department through the many transitions related to the uncertainties around the COVID-19 pandemic. She's excited to push Fresno Unified Nutrition Services to be a model among school districts with a focus on nutrition, quality, and variety. We're so glad to have you, Amanda. And finally, our third panelist is Tamara Sandberg, who serves as the Save the Children's Director of U.S. Food Security and Nutrition. Tamara is responsible for helping lead the global nonprofit's emerging work to ensure children across rural America are getting the nutritious meals they need to succeed in school and in life. Sandberg previously served as Executive Director of Feeding Kentucky, the lead No Kid Hungry partner in Kentucky. Welcome, Tamara, and thanks so much to each of you for taking time to join today's discussion. We're fortunate and thrilled to have you. And so I'd love to go ahead and get us kicked off with our Q&A. And I really enjoyed the conversation last week ahead of this call. And I wanted to ask Amanda, if you could get us started with what you've seen in your district in California. Can you share how non-congregate meal service figured into your response and the importance of school district leadership in that regard?
Yes, absolutely. We closed schools on a Friday afternoon, and we had to transition in nutrition services from serving in a cafeteria to curbside over a weekend when we had told staff not to come back on Monday. So we quickly had to also remind nutrition services staff that they do have to come back, which I'm sure you can imagine that might have some concerns with staff. So it was quite a transition, but like I said, over the weekend, we were able to start serving curbside on that Monday. And it was obviously full of challenges, but we managed. And in that time, we've served almost 12 million meals since schools closures. I do want to clarify, because this is about rural hunger, but I do represent Fresno Unified, which is an urban district. So I'll be able to share kind of some of the items, some of the things and challenges that urban districts had to deal with as well. But to ensure safety and food access. So obviously our concern is to ensure that our community, our children were continuing to get meals during this pandemic. And we absolutely could not have done that without the many, many waivers that were put in place. Especially important was the non-congregate waiver and the parent pickup waiver and the meal pattern flexibility. Those were the major waivers that we could not have continued to serve nutritious meals to our children. And you mentioned, Derek, the importance and leadership of our superintendent. He on Sunday night said, we're not just feeding children, we're feeding our adults, our community, anyone that is in need, we are serving them. Obviously, we were unable to pay for those meals out of our cafeteria funds. So that was a general fund expense from the district, as well as a partnership with the city of Fresno. They did help fund several of those meals. That was a very powerful thing for our staff. Pre-pandemic, the Friday before, no one thought about our kitchen workers. That wasn't priority. We served food every day and it just happened. But then, Monday, we were kind of the only thing happening, and it was a big, big deal. So for our staff, as challenging it was to be there and feel maybe that they were putting themselves at risk, they also realized how important it was to continue serving our children and our community and getting these meals out to them. So I think it really kind of helped us elevate the important role of nutrition and nutrition services in our schools.
And Amanda, I think that is a realization for many Americans over the course of the pandemic, the importance of that work and really the heroic efforts of school food service staff. So thank you on behalf of, I'm sure, everyone on this call. Thank you, and thank your team and staff around the country for the work that you've done. And thank you for sharing the importance of the parent pickup waiver and the meal pattern waiver, and the fact that you're able to pivot really on a dime, and you've served more than 12 million meals since the beginning of the pandemic. It's really astounding what you and others have done. And Kathy and Tamara, I want to bring you into this conversation as well, because I know Amanda talked about the parent pickup waiver and the meal pattern. And I know that when we talk about non-congregate, we're really talking about a range of different service models. So the parent pickup that Amanda referenced, home delivery, mail to home models. There's also, of course, Pandemic EBT, which has provided support for families and caregivers to buy groceries at food retail outlets. And so, creativity and innovation have really been, required during this time. And these models have really opened up some possibilities that weren't there before. Can each of you talk about how that's looked in the communities that you serve and any service models that you found to be particularly effective?
I'll go ahead and jump in. And first, I do want to say that as I was talking to school nutrition directors from around the state, I want to give a shout out also to Amanda, because I think they really are heroes of the pandemic, and they were heroes in Arkansas because they stepped up and went from serving maybe in a cafeteria and breakfast in the classroom to doing breakfast in the classroom, breakfast in a cafeteria, second chance breakfast, pickup of meals for virtual students, delivery of meals, frozen meals, shelf-stable meals. So just within a matter of a few days, they pivoted to doing all of those things, and without complaint, and like Amanda said, putting themselves at risk. One of the biggest barriers in Arkansas is transportation. That was true before the pandemic, but it was exacerbated because of the pandemic. And so because of the waivers and many of the changes that our team at the Alliance worked on, we had a lot of school districts who were doing 5 days worth of meals Early on, we did a lot of the Meals to You delivery program in Arkansas, and just going to places that typically they were not allowed to go to prior to the pandemic. They did incredible work with not a whole lot of fanfare and not nearly as much praise as I think they deserved.
Right.
Thanks,
And
Kathy. And Tamara, yeah, I'd love to hear your experience there with Save the Children and all the partners you're working with in communities around the country.
absolutely, it's very similar. We worked a lot, and we have heard from school districts and community-based organizations in Tennessee and Texas and South Carolina and Mississippi, Washington State. And what we are hearing in rural communities is these waivers made a huge difference. Almost every single member of our network said they were able to offer significantly more meals because of these waivers. The non-congregate, as has been mentioned, really made a difference because so many children in rural communities, even outside of the pandemic, do not have a way to get to the meal site safely. My children lived about 2 miles away from our school, but there was no sidewalk and there was no safe way to get there. So if I wasn't able to drive them, they would have missed out. There's not enough sites by and large in rural communities. So it can be hard for the kids to access the meals as it is, just because we don't have the economy of scale that you mentioned in your introduction. So the non-congregate waiver absolutely made a difference. Both for making sure that school districts and community partners could get the meals to the kids. And we heard so many stories of families that were scared to leave, scared to go to the grocery store. There was no food on the shelves that they thought, and the food banks weren't serving. And so to see the school's mobile meal delivery bus coming down the lane, delivering food was, I mean, truly a lifesaver and made a huge difference in rural communities at the height of the pandemic. It also allowed our under-resourced rural communities to do more meals, because instead of having all the children eat in one group and wait until every last child has finished every last bite, they were able to have many more stops than normal and get more meals distributed and more meals served. So the non-congregate and allowing multiple meals at once were huge. I'll stop by just sharing one story that I heard from a grandparent raising a grandson in Morgan County, Tennessee. He has limited mobility. He's got an unreliable vehicle. His grandson has serious health issues, including a skin disease that means he can't be out in the sun. So congregate meal service was never an option for this family anyway. And for this grandfather to have to drive, it's 30 minutes away. It takes him 30 minutes to get to the feeding site. If he would have had to do that every single day, to pick up a meal every single day, his grandson would have missed out. But because he was able to go and pick up multiple meals a day and multiple meals at a time, he was able to time that and get all his errands done, go into town once a week. And it really met the need of that family. So we love the waivers, and we definitely saw a substantial increase in kids served as a result.
Thank you so much, Tamara. And the example from Morgan County is so powerful. And I think we're hearing a lot about the importance of the non-congregate waiver, the importance of the parent pickup waiver and multiple meals to be able to reach children and families, especially in a health crisis where folks were often, trying to minimize contact. But one thing I'd like to dial in on as well is the impact of the area eligibility waiver, which allowed sponsors to serve all children in their communities and has permitted greater flexibility in terms of meal site location or site pickup location. The area eligibility waiver meant that all children could participate in programming and that sites could be located throughout the community in locations that are best determined by local providers instead of, eligibility threshold cutoffs. And Amanda, I know this looked a little bit different in your community since you actually operate the community eligibility provision. You were operating CEP before the pandemic, which meant that all children in your community were already eligible to participate in programming. So can you talk a little bit about how the ability to serve all kids without distinction helped streamline your district's response during the pandemic?
Yes, so that is something that we've been doing. We've been operating under the community eligibility provision since 2014 school year. And so that was one extra burden that we didn't have to think about. We didn't have to think if this child is a paid child or a free child. It was just every child 1 to 18, no questions asked, was able to get a meal. It's in a normal school year, it's a huge benefit to our families and our community. And so any districts that are able to qualify, I strongly encourage them. It's very much streamlines our paperwork on our end, but also that's, if the area eligibility continues, it expands, it just makes access so much easier for everybody involved.
That's great, Amanda. And I think that's important that you bring that up, because CEP is a way to maintain that expanded eligibility beyond the pandemic, because a lot of what we're seeing right now with these waivers with the summer meals program, those are set to expire at the end of the summer. And we know that CEP is a really powerful tool to maintain expanded access for kids participating in these programs. And Tamara, go ahead, Amanda, did you want to add something there?
Yeah, I was just going to add, absolutely, and that not all districts are going to qualify 100%. So expanding the area eligibility will help ensure the access of meals to students that are in need.
That's a great point, Amanda.
Mm-hmm.
And the piece you said about the administrative streamlining is really significant as well. Would you mind expanding just briefly on that, the ways that CEP has made your life easier in terms of the paperwork burden? Oh.
Sorry, I was having trouble unmuting.
Okay.
Absolutely. The administrative, it releases the administrative burden on our staff as well as our parents. So we don't need to do that income eligibility form, the applications every year. So it helps parents, it helps students, it helps our nutrition services staff as well. So, there's none of the forms are included or necessary. There's obviously paperwork associated with CEP that are required, but it's much streamlined compared to prior.
That's great. Thanks, Amanda. Tamara, I'd love to turn to you, because I know that Save the Children facilitates a rural school nutrition directors network. And you've mentioned recently on an earlier call that you've been hearing from your network members about the need for expanded flexibilities to better serve children and families in rural areas. So would you mind sharing with folks on the line today what you're hearing from those members around the area eligibility waiver, some of the other flexibilities that USDA has provided during the pandemic?
Sure, absolutely. And that network is open to any rural school nutrition director, by the way, so we'd love to have more people already involved. But yes, the community eligibility provision, to Amanda's point, our rural school districts are stretched thin, and it could be the same person who's ordering the food, packing the food, sweeping the cafeteria, driving the school bus. And so to eliminate one layer of paperwork has really made a huge difference. We're hearing almost universally from the members of our network. Another benefit of CEP is an additional barrier in rural communities is the stigma associated with free food. And there's stigma in urban areas too, but in rural communities where we tend to know everybody, and everybody knows everybody's business, and everybody sees who's in line at the WIC. The CEP, the community eligibility, really has served to normalize getting free meals, and kids of all income have been able to enjoy it, and it's helped take away the shame, especially some of the older kids we're hearing from that have been hesitant to accept meals from schools because they're embarrassed about it. That's been another benefit of the community eligibility provision as well. So we'd love to see that continued. It's made a big difference in our communities.
That's great. Thanks, Tamara. And Kathy, I'd actually love to turn to you. And do you mind talking? I know we've talked about, the possibilities afforded by Pandemic EBT. We've seen through research, USDA has shown that summer EBT is an effective intervention to alleviate food insecurity. But you've also highlighted, that there can be some limitations in terms of the impact of that program in areas where there's grocery store closures. And so as much as we know about the positive effect of Pandemic EBT and summer EBT, this really highlights the need for providers to have multiple options to serve children and families in rural areas. Can you discuss that a little bit, share what you've seen in Arkansas, and also any challenges around, access that may have even predated the pandemic?
I think about, if you'd asked me 5 years ago, what would the one sort of silver, or the one thing we needed besides more congregate meal sites to help with summer childhood hunger, I would have said summer EBT. And then we had a wave of grocery store closings a few years ago, and I realized, well, that's really not the only thing we need. But it was really brought home this past year and even in the last 2 or 3 months, because we had another round of grocery store closures. Arkansas has some of the highest rates of food deserts in the United States, both in rural, particularly in rural areas. We have counties with no grocery stores, but even in Little Rock, where I live, we've got parts of the city that are considered food deserts. So, so our answer to what do we need to solve this problem, we need permanent summer EBT, but we also need all of the flexibilities that we've seen during the pandemic, including the multiple meals, the non-congregate meals, the meals that can be delivered directly to somebody's house. The answer is all of the above, not one or the other, because too many people in Arkansas don't have transportation. In rural areas, there is no public transportation. And even in the cities, it's very spotty. So the answer is all of the above.
Yeah, I appreciate that, Kathy, the importance of all these different options, because there's not going to be one silver bullet solution that's going to apply equally to all communities. I also appreciate that you highlighted how the challenge of food deserts is a reality in rural areas, but actually it's something that we see in other community types as well. And I think it harkens back to what we are seeing in that the data is that the flexibilities have really allowed for expanded access in rural areas, but also in other communities that may have experienced similar challenges. And Tamara, you've mentioned how it can be challenging for some of the small rural districts that you work with to operate summer meal programs over the entirety of the summer. They may operate for part of the summer, but they may not operate from end to end. And that there are times when community-based organizations are called upon to fill that gap. And so, to build on some of what Kathy shared and the importance of having this all of the above approach, what strategies are you finding are as successful to keep school districts and community-based organizations coordinated in their response and pulling in the same direction to make sure that the programs that are in place stay in place through the summer and that they're accessible?
Yeah, we've seen great success with community-led approaches in rural communities. The schools, undeniable, they are the hub of many rural communities, and they're limited. And as Amanda mentioned, our school staff are exhausted, and many of them have been working like in the trenches very, very hard since the pandemic struck many, many months ago, and they're tired. And that's one of the challenges we heard from the members of our network this summer of it's hard enough sometimes to find staff that are able to work over the summer months to distribute summer food service program meals, but even more so this year when people are just exhausted, and rightly so. They've been working very hard. And that's why, I completely agree with Kathy that I believe it's an all of the above option, that congregate meals with enrichment activities provided, that's the pinnacle, that's what everybody wants. But for rural communities that may not have enough sites that are able to operate it, that we need other options like the SEBT, but that assumes you can get to a grocery store and that you have access to a full service grocery store. And we know many rural communities do not, at least not that one that's easily accessible. And so I, like Kathy alluded to it, there's so many opportunities to be bold and innovate as a result of the pandemic. And this mailing food boxes directly to homes, I think, is a really interesting idea. It's a great opportunity. Yet another tool in the toolbox for families who can't get to a congregate site, can't have a meal delivered, don't have a full service grocery store that accepts EBT, then let's consider innovative solutions like mailing boxes directly to homes. But to go back to the main point of your question, it is absolutely community organizations and schools working together that we believe will make the biggest dent in summer hunger. For example, we've seen rural communities have their churches coordinate so that they're not all offering their summer Bible camps all in the same week, and that every church in town is offering meals the same week of July, and working to coordinate and time it a little bit better so they know if the school is going to stop serving meals mid-July, then the church is on board and they're ready to pick up the next week and the week after that. So community-driven approaches really are the key to ending summer hunger, we believe.
That's great, Tamara. Thank you for sharing that. And I think in terms of thinking about the role that all of these different interventions have to play in making sure that programs are available to kids at any point in the summer, regardless of the type of community or the rurality of the community someone might live in. I want to circle back to you, Amanda, to kind of look at this from a different angle, but keying on that theme of keeping school districts, community-based organizations, and different stakeholders aligned in terms of the programming that best serves kids and families. Would you mind talking a little bit about how your team and your district views pandemic or summer EBT as a complement to the programming that your district offers within the community?
Yes, we really were, education for parents will be very helpful. We kept trying to get out, that even though you have received the EBT cards, you still can continue to participate in our meal program. So we did see a decline in our meal service oftentimes when those went out. And so really we would hope that they continue to get the access to the meals and participate so that their EBT monies can go further. So that again, it's there, those meals might not be available in rural America. And so that's why there's a need there. But there's also, we are full of food deserts. Fresno City in Fresno County also has a lot of rural areas outside of it. So it's just the need is going to continue. This pandemic didn't create food insecurity in our nation. It has just highlighted it.
Yeah. Thank you so much for sharing that and giving that context. And I know we've already talked about, we're so thankful for the work that your team has done. And Tamara mentioned, spoke, I think, compellingly to just the exhaustion, the fatigue, and yet still so many food service folks are just still going in to the trenches every day and making these programs operate. And that being said, I know we also are starting to think about the school year to come. And so, we're already thinking about the fall, and there are, back to school and guidelines are being announced and districts are making plans. So can you share a little bit about how your district is looking at and planning for the upcoming school year?
Yes, we came back, we had been fully virtual until the first week in April. We came back at a hybrid model. So students were back 2 to 3 days a week and then virtual all other days. So we continue to serve our virtual, we continue to have our curbside meals for our virtual students. And then, so our goal, currently we're on track to have all students that want to come back to campus and are able to come back to campus to have a space in their rooms. August 12th is our start date. I have not heard anything different to that, but we do have, we always have had a distance learning option. So we will continue to have that for students that are unable to return in the fall. And so we're, we're really planning we're actually very excited to have our full scale meals back, because our meal service did definitely get streamlined during the pandemic. So we're eager to be able to highlight new menu items and go back to our full array of meal options.
Got it. Is there any menu, anything about your menu you're especially excited about? I know you sound like you're looking forward to bringing on some different components.
Yeah, so our middle and high school students, one of the waivers was that we didn't have to have offer versus serve and multiple choices. And so it's just, they went from maybe having 7, 8 entree options a day to, 1 during the pandemic. So I'm excited for our secondary students to come back. And some of our secondary students haven't even been in a full scale lunch opportunity. I'm excited for our little ones who have never actually been to school. So to see their faces when they get their school meals and our staff, to have our children back on campus is definitely what motivates us for what we do.
And Amanda, I think a lot of folks are kind of craving a return to normalcy, right? On some level, after all we've been through. But Kathy, I want to turn to you, because I know that you're in Arkansas, and that's a state that is currently seeing like a lot of places, but I think Arkansas and Missouri are definitely kind of a hot spot where there's been a significant uptick in COVID-19 infections. So do you mind sharing a little bit about what things look like right now where you are and your thoughts on potential impacts for the school year ahead?
Well, like you said, we've been in the national news a lot lately, and it has not been encouraging. I looked at the numbers today, and in the last 14 days, we have accomplished in a negative way what took 2 months to see in the middle of the pandemic. And so when you think about it, that's really staggering that we have the same number in the hospital in the last 14 days that it took 60 days to get during the middle of the pandemic. And one of the biggest problems with that, when we talk about schools, is that our children's hospital is almost at capacity. There are a lot of teens and adolescents, COVID-related, respiratory-related, teens on ventilators, and our healthcare system in Arkansas, I mean, our healthcare professionals are just crying out for our elected leaders to do something, but they've chosen to pass laws that say school districts are not allowed to pass mask mandates. We're not allowed to require vaccinations. And so we have the lowest vaccination. So, I won't go into that, but so when we talked to school nutrition directors a couple of months ago, people were preparing for a return to somewhat normalcy. And in the last 2 weeks, everybody has shifted their thinking. And to echo what both Tamara and Amanda said, we've heard from every school nutrition director that they're trying to give their employees some time off now because they're so burned out. So they're trying to keep up with meal service now while giving as many people as possible time off. And some of the districts told us that they're preparing to again be able to go virtual, to make that switch, not if it happens, but more likely when it happens. And the schools the Department of Education has already changed a couple of things. We initially said if you wanted to go virtually this year, you had to sign up and stick with it for the whole year. Last week, there were new guidelines that said you have to stick with it for a semester. So I don't know what will happen next week, but that's where we are today with way too many things up in the air. Parents are incredibly stressed. Teachers are stressed. The nutrition workers are stressed. As an elected official, I'm stressed. It's very stressful.
I'm sorry to hear that, Kathy. And I know that, Missouri and Arkansas are a couple areas where we're really seeing an uptick, but I know nationally the trend line has kind of been moving in that direction as well. And so I think these are the kind of tough questions we're all going to have to be wrestling with in the weeks ahead, unfortunately. And hopefully, we can all hope for the best, of course, and hope that things will not continue in the direction that they seem to be going in some places. I want to just put a call out to our attendees that we'd love to get your audience questions. So please feel free to go ahead and submit those in the Q&A box. I think we've got some coming through here, and my colleague Irvin's going to triage those shortly. But before we get to those, I'd love to hear, and Kathy, I think what you were sharing is kind of a good segue to this. I'd love to hear all of your different thoughts and on some key lessons that we maybe can pull from this period that we've been through from the pandemic. Especially with regard to rural communities and some of the areas that you're seeing where things are working well, where you're seeing persistent challenges, and specifically keeping in mind that we have this opportunity through child nutrition reauthorization to make these programs provide the flexibility, provide expanded access in ways that accommodate and reflect the realities in the rural communities around the country. And so if you have any stories from your community that might help bring those home to our listeners, that's great. But also just curious to get your thoughts on what should we be keeping in mind? Those of us on the line today, what should we be thinking about in the context of CNR as it pertains to the pandemic, as it pertains to rural communities, and how we can make these programs work better? So Kathy, I'd love to hear from you. And then Tamara, I might pass over to you, and then Amanda, time permitting.
I think to put that into context, I want to share a story from one of our rural school districts. And I think I mentioned them earlier that they typically pre-pandemic did breakfast in the classroom and then the rest of the meals in the cafeteria. And then within a matter of a week, they went to having kids at school, kids who were permanently virtual. And then on one day a week, everybody was virtual. And and so the school nutrition director and all of those workers pivoted to doing about 5 different types of meals per day. They did pickup, they did delivery, they did frozen meals, and multiple meals, so you could get 5 days worth of meals all at the same time. And I will point out at the beginning, you mentioned the amount of grants that Share Our Strength had been able to provide around the country. And this school district was one of the districts in Arkansas that was a recipient of some of that money. And one of the reasons they were able to do some of these frozen meals was because of the grant money that you all provided to them. So they kept their focus the whole time on the kids. And the school nutrition director told us that when they got out of school, she followed the bus during the first week. And when it stopped at an apartment building and it makes that backup, that beep, beep, beep when it backs up, and she said it was almost like the ice cream truck. And while we wish there were not children in that apartment building who needed these meals, she said the kids all came running out to the truck and they had great interest in the meals that they were going to be getting. And they particularly liked the meals that came in the black cartons with the clear lids that were the ones that were made available through Share Our Strength, because they could prepare those meals themselves. And she said when she saw the kids and talked to the families, it meant that everything she did, every extra hour, made it all worthwhile because their kids and families got what they needed during the pandemic. So it just shows that the waivers we had in place, community eligibility, all of the above again, is what I hope we look at going forward, because if we're serious about ending childhood hunger, that's what it's going to take.
That's great. Thank you so much, Kathy. That's such a powerful story. And I do want us to get to the audience Q&A shortly, but Tamara and Amanda, I'd love to give you, if you can just in a quick, maybe 30, 40 seconds, I'd love to get your thoughts on this too, as we look ahead to CNR and any stories that have stood out to you.
Yeah, I'll just jump in real briefly. One thing we haven't really addressed is the communities of color and how they've been disproportionately impacted by the pandemic and child hunger. And we hear heartbreaking stories. And I heard from a family in South Carolina of a woman with 2 small children in a stroller walking up to the summer feeding site, 5 miles in 95-degree weather. And she put the box of food in the stroller, put one child on her back and had the other hand and walked 5 miles back home. And so that community, the school is working to reach out with new partners. Some of the pastors in town are helping deliver boxes. They're partnering with a Head Start program and the public library to really come together to make sure every child in that community has the food they need over the summer months. And it's only, the waivers will only help that goal be met quicker.
That's great. And this is such a rich discussion. Amanda, I'm going to hand it over to you for any final thoughts as it pertains to this child nutrition reauthorization. And then my colleague Irvin is going to pick things up with our audience Q&A. So Amanda, any thoughts on this front as well?
I really kind of just want to reiterate what Kathy and Tamara said. The Share Our Strength grants were a huge, and in all the grants, we received several. I've never done so many grants in my life this last year and a half related to food access and nutrition. And they really helped continue our program and move our program forward as we start to go into the new school year. And as far as, stories that we had, our food service, our nutrition services staff, they received cards, they received letters from children, drawings. The kids were just so excited to be in the car and see a regular face a masked face. They didn't get to see our smile, but they got to see us. And also, we had a devastating, California was on fire last summer. And so near us, we had a very devastating creek fire. And so many families had to evacuate and they had no means for meals. So we were getting lots of calls for our creek fire evacuees as to how to access our meals. And because of the, our CEP and if we didn't have that, we would have had the area eligibility waivers. It just continues providing meal and access to meals.
Thank you so much, Amanda. And Irvin, I'm going to pass it back over to you to field some audience questions with our panelists. I think you're still muted, Irvin.
So sorry about that. Thank you so much, Derek, and I certainly appreciate hearing from my panelists and all the valuable level of expertise and insights that you have surrounding this issue. So very much appreciate hearing from you all. It was really an insightful conversation. We'll now transition to Q&A. It looks like we have just a few questions listed in the Q&A box. The first question that we have here is, because CEP eligibility is determined through SNAP enrollment, is there a risk that some school districts that have high percentages of non-citizen students will be unable to qualify for CEP because many non-citizens can't enroll in SNAP? If so, do you all have any ideas on how to work around that? Amanda or Monica, would either of you have any insight about this particular question?
I can go ahead, Amanda.
I was going to hope that Monica could. I can speak to it, but she might be able to speak a little bit more eloquent about it.
Actually, what it is that kids qualify for free and reduced price meals. They're certified for free and reduced price meals when they're enrolled in SNAP. And I think the bigger issue is that what we saw was the chilling effect of the public charge rule that really created a lot of fear and confusion among families, particularly immigrant families and children in mixed status families. So a lot of these families ended up disenrolling in these programs, even though they were eligible to receive and participate in these programs. So I think what is incumbent upon all of us is to, one, remind these communities that the public charge rule is not in effect. And I think two, to provide good, valuable, trustworthy information to these families and working with trusted partners to help them to understand that they will not incur any kind of immigration consequence as a result of them enrolling in these programs where they are eligible to participate. So I think what we're really dealing with is the chilling effect. And it's not just in the nutrition programs. One of the things that we have learned is that there's been a significant drop in Medicaid and the programs as a result of this fear. So I think it's important for us to also recognize is that some children, are able to participate in these programs and that they don't require verification of status, immigration status. So I think to the extent that all of us can do a lot of work to provide good information would be incredibly helpful to address this, this consequence as well. And I'll see if there's any other folks on this panel who want to respond.
And I'll also just add that even just the education of the meal participation. So our district is CEP, but I think that fear is still there that they can't have the free meal, and it's available. Nothing, that's status is not tracked. So it's still available even once the district is community eligibility provision.
Thank you so much for your insight. And before we move on to the next question, I just wanted to give Tamara and Kathy an opportunity if they have additional context to provide some insights if possible. Kathy and Tamara.
I think they covered it well, just making sure families understand the rules and help get the correct information out and reducing the stigma, whatever your status is. I think it's key.
That's great. Our next question here is, how are your organizations preparing to transition out of the COVID pandemic? What regulations do you think should stay that were adopted during the pandemic? And what regulations do you think should be done away with? Certainly, if anyone's eager to answer that question. Otherwise, Monica, would you have any insight there?
I'll jump in. I do think Kathy said it best. It's not a one or the other. It's really an all. And we have rural and urban represented on the call. And it, some were needed for urban, some were needed for rural. They're so necessary to continue food access. And we had these waivers in place, and as much as we could continue to maintain our maintain the integrity of our program was our biggest concern. When there's a parent pickup waiver, it makes it challenging to ensure that integrity. So that was a big concern for us. So we, did everything we could to ensure integrity. And then, we have, like I mentioned earlier, the meal pattern flexibility was huge. As a degree nutritionist, it's important to me to serve nutritious food. Just because I have this waiver, I'm not going to throw all the rules out of the, out the window. So I think districts are still maintaining the integrity to the best of their ability. But if our vendors are unable to provide a grain on a day, I'm still able to count those meals. I still served a meal. So it's not one or the other. Everything's needed for somebody somewhere. Each district is a little different.
Absolutely. All of the above approach is certainly critical, especially as we continue to grapple with everything that's related to the COVID pandemic. It's important that we use these flexibilities and all of the above approach in terms of, making sure that we have, summer EBT and the non-congregate meal flexibilities available to reach as many kids as possible, particularly though children who live in rural and hard to reach areas as well. But certainly I wanted to give Kathy and Tamara an opportunity to, provide some insights about how their organizations are preparing to transition as well.
I'll jump in. I think the key takeaway is the challenges that we're facing in rural communities they're not going to go away when the pandemic ends. And the waivers that were enacted that helped so many kids get fed over during the pandemic, we still need those same flexibilities in rural communities. So Save the Children, one of our advocacy priorities is just to continue to ask for these flexibilities, that we have multiple options available in rural communities, that if there isn't a grocery store, that we consider other options to make sure that kids have the food they need. We really need flexibilities. Even before the pandemic struck, we were struggling with transportation challenges and the unprecedented heat wave in California and Washington. That is not appropriate in congregate settings, no matter whether it's a pandemic or not. So we're really hoping that we'll continue to see these flexibilities enacted permanently that make it easier to feed kids in rural communities.
And Irvin, I'll just add one quick thing. As we start to transition, one of the important things for us pre-pandemic and during the pandemic, the folks on our No Kid Hungry campaign are considered trusted partners by school districts and by community organizations. And they look to our No Kid Hungry team to be knowledgeable about all of the options out there, to be knowledgeable about grants, to be able to assist them. We have a former school nutrition director on the No Kid Hungry team, and that goes a long way for us when we're talking to school nutrition directors around the state who constantly feel overwhelmed, and rightly so. So maintaining our relationships with our congressional staff, the Department of Education, and all of our partners in the field is something we spend a lot of time on, just touching in with people, making sure they're okay and seeing what we can do for them.
Excellent. Thank you all so much for your insights. The next question that we have here is, we know there's a proposal to expand the community eligibility provision, or CEP. Would such a proposal be useful in reaching more children with the meals that they need? And I realize this is an issue that Derek had touched upon in our panel discussion, but if you guys have any additional context as to how useful this particular proposal would be, that would be appreciated. Amanda, would you have any additional insights on that?
Sorry, I apologize. I was looking for the question and I missed it. Sorry, can you repeat that?
Oh, sure, no problem. We know there's a proposal to expand the community eligibility provision. Would such a proposal be useful in reaching more children with the meals they need?
Yes, so obviously as a district, we were one of the first large school districts to implement community eligibility provision, and I can't speak enough about how important it is. And so if it's going to be expanded to make it easier to access, or, absolutely, I will keep pushing for districts to do it. I do know that there are districts that qualify and they're, hesitant to start it. And I can't speak enough about the value of it to ensure. And Tamara, thank you for mentioning, it's the stigma too around the meals that is huge for our children. So absolutely.
That's great. And that is the very last question that we have here. But before moving on, I just want to give Tamara, Kathy, and Monica an opportunity if they have additional insights or context to provide for that particular question. I also wanted to leave it open for you all to provide insights as well.
Well, I think my final thought might be if there was one silver lining to this pandemic, it's that we have learned that there are solutions that we can implement, policy change, regulation changes that make it easier to feed the kids who need it most in rural communities. And so I'm really hoping, and I'm grateful for Share Strength for pulling this together, that we can build on the momentum and the lessons learned and continue to innovate to make sure more kids have the food they need to thrive and succeed.
That's great. Thank you guys so much. It looks like those are all the questions that we have at the moment. We certainly appreciate hearing from those of you in the audience as well. I'd like to thank our wonderful panelists for their insights and expertise surrounding child food insecurity in rural America. And I know I speak for many of us on the call today in expressing gratitude for the contributions that you all have made to ensure that every child has access to reliable, nutritious meals throughout the year. And to reiterate, it's critical that Congress passes a bipartisan child nutrition reauthorization bill that permanently authorizes the non-congregate meal flexibilities, as all of our panelists and our moderator had touched upon during our panel discussion earlier, a nationwide summer EBT program, and other key provisions that really enable schools and community sponsors across the country to feed more children, especially those in rural and hard to reach areas too. And with that, it looks like we are just about at the end of our time together. To those of you in the audience who may have additional questions related to the briefing, you're certainly welcome to send me any questions you have by email. And again, we thank you so much for joining us, and take care.